welcome to the African Community Forum. My name is Obi Mwawe, and I'll be your host today. On today's show, we'll talk about healthcare in the area. I'm joined by Dr. Adrian Ngudiankama and Vanita Myers. Dr. Adrian Ngudiankama is a health advocate currently working with the Montgomery County African American Health Program, a Baptist chaplain at American University, and a longtime health advocate in the community. Vanita Myers is Director of Housing Program for the organization Community Health and Empowerment through Education and Research. Welcome to the show.
Thank you.
Thank you very much.
So can you talk to us a little bit about your organization's involvement with health? Ms. Myers, I'll start with you.
Sure. Thank you for having me today. Community Health and Empowerment through Education and Research, or CHEER for short, is a nonprofit that does community development in Tacoma Park and Long Branch. Long Branch is located between on the border of Tacoma Park and Silver Spring. And our work began in 2008 and includes the areas of health, housing, civic engagement, and youth development. The mission of the organization is to work with people in the community and make sure that they have the knowledge and the tools needed to help them create healthy and thriving communities.
Okay. Doctor, tell us a little bit about your organization's involvement with health.
Yes, the African American Health Program is funded by the Montgomery County Department of Health and Human Services and administered by the McFarland and Associates. The African American Health Program was created and funded in 1999 by the Montgomery County Department of Health, as I said, and its mission is really to eliminate disparities of and improve the number of and the quality of years of life for African American people, just in this county of Montgomery County. And the program focuses on 7 major programs: mental health, oral health, cancer, diabetes, HIV/AIDS. Those are just programs in which we focus.
So from all you listed, what is the major concern health issue in the community?
I've said that the major concern of the health issue in the community, as far as I'm concerned, is mental health.
Okay. What about you, Ms. Myers? What would you say the major health issue concern is?
The demographics that we serve in our area are largely Latino and African immigrants. And we have discovered that the most pressing health needs in those areas are diabetes, alcohol and substance abuse, pediatric asthma, and access to health care.
Okay, so that the concerns run a gamut of a whole lot of things. So why do you think that a lot of people are not informed about how to deal with these health issues, or are they?
People are not informed for many different reasons.
Okay.
First, many of them don't know about the resources that are available.
Okay.
And again, even when they know about the resources that are available, they don't know how to have access to them.
Mm-hmm.
I said earlier that as far as I'm concerned, some of the major issues in our communities are mental health. But again, to that I can add issues like cancer, diabetes, oral health. Those are very, very important issues.
Ms. Myers, would you agree that a lot of people are not well informed about how to deal with the major health concerns that you mentioned?
It depends on who you're talking about. For some, I think it's just fine, but for immigrants, in particular minorities, low-income people, I think that you get a completely different answer in addition to what the doctor said. I also think that our community is extremely diverse. I think that language is a barrier, understanding the system.
So why do you think that a lot of people are not informed because they don't believe in the health system, or do you feel that more needs to be done on the part of the healthcare providers to inform the people?
There is a serious problem here. The problem is, in fact, when one sees how those resources are available in the community, but again, the extent to which the health status of immigrants is so poor, just one says that there is something wrong with the picture, because resources are available, but still the health status of immigrants is so poor. And the problem, to my view, is that some of the programs that exist are not culturally competent. That's the problem. And when we speak about cultural competence here, not only that people are not using the language that they should be using so that they can tell to immigrants about the self-resources, but again, all dynamics of relationship between those healthcare providers and the people who have to consume the services. I mean, the immigrants, in our case, the African immigrants.
So would you say, and clearly there's a gap in communication on how to reach the people that the healthcare system is supposed to cater to. Now, would you say that, for instance, some immigrants, that the problem or the reason why they are not getting that information, because, you know, it also depends on different religions and, you know, backgrounds where they're from. So, you know, some immigrants might say, where I come from, we don't ask for this, forgetting that you're in a different society. So what do you think about that, Ms. Myers? Have you encountered anybody that walked into your office and they are having a problem with health system, or they don't want to, you know, accept the what's being offered to them?
Different cultures respond to things in different ways, and that is a barrier. But I also think that there's a lack of access to information and resources. I think that more things need to be communicated to people in their native language. I think that there needs to be more people who personally reach out to the community and explain things to them and guide them through the process. Because if you weren't born here and aren't familiar with this, it's very difficult to navigate the system and to understand what needs to be done to get what you need.
In your opinion, doctor, do you think the state has the resources to go out and do the legwork that's involved to educate these people?
I think the resources are there,
Okay.
but again, how do we design them? And the issue of cultural competence is very, very important here.
Right.
Just the problem of our people, not that they don't want to get access to those resources, but, and the question is not necessarily that they don't know that those resources exist, but there are different dynamics, and these dynamics have to do not only about cultural concepts of health, but that relational dynamic between the healthcare providers and the consumers.
Okay.
There is a big problem there. And again, when one sees, for instance, who are those most healthcare providers, how much do they know about the cultures of these people?
Right.
And again, just one of those who argue that most of health issues among African immigrants, the causes are what they call socioeconomic.
Okay, so clearly we look like we've opened up a can of worms, and we need to discuss this a little bit more. We'll take a short break. When we return, we'll talk about some of the programs in the area. Stay tuned, we'll be right back.
I love taking care of my mom. It wasn't easy at first. She learned how to better communicate her needs.
And you learned how to not ignore yours.
I discovered how to make healthier meals.
And I discovered how much I enjoyed them.
Becoming a caregiver is a learning experience for everyone. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.
They said I have troll teeth.
That my voice sounded like a possessed baby doll.
That no one would ever love someone as stupid as me.
That I was fat, ugly.
Disgusting.
The effect of bullying is potent.
We will no longer be the silent majority.
Now, when you see online bullying, there's something you can do about it.
We're gonna take action with the I.
I am a witness.
I am a witness.
I am a witness.
I am a witness.
I am a witness, and so are you.
Hi, my name is Sumbo Pujay, and I'm a fourth-year doctoral student at Morgan State University. I am currently undertaking research that aims to explore the attitudes around mental health services in the African immigrant population in DC, Maryland, and Virginia. If you're able to participate in this survey, please contact me at the information listed below. Thank you so much.
Welcome back. I'm here with Dr. Ngudi Nkama and Ms. Myers. Before the break, we touched on some of the concerns and illnesses in the community. We'll now talk about the current healthcare system and look into some health programs in the area. Like where we left off, we were having a great conversation. So clearly, we already, from our previous conversation, we can say that there's a gap. And would you say that the healthcare system currently in place works or needs to be tweaked, or what is your take on that? I'll start with you, Doctor.
Yes, I think I always say that the well-being of every institution or any institution depends on the well-being of its individuals. If people are not healthy, just institutions are not going to go well. And responding to those agencies as far as health issues of immigrants are concerned is a big chance. We have to do that. The African American Health Program has programs that are responding to just those concerns. As I said earlier, we've got programs on mental health, we've got programs on cancer prevention, we've got programs on diabetes, we've got programs on oral health, and we've got programs on infant mortality, which big issues. It's just we are bringing this information to people to know where we are. Just if people can get in touch with us, just we have ways to help them.
Okay. So, Ms. Myers, would you say the structure right now is currently working or not working, or some work still needs to be done?
I think there can always be improvement. And as I said before, I think it probably works better for some than others. In particular, not as well for low-income people and probably immigrants and minorities possibly. I think that there are a lot of good things that are happening with the Affordable Care Act. The county has some programs that allow immigrants who to receive health care. We have clinics, and I think all of those things are wonderful, and a lot of people are able to get some of the help they need that they wouldn't otherwise if those programs didn't exist. But I think there can always be improvement, and that people need to continue to monitor what's happening, what the barriers are, and respond accordingly.
Should, from your experience and your expertise, should immigrants or that are not yet legal in the country, should they shy away from benefiting from these programs? I'll start with you, Doctor.
I think just institutions like ours care. We care for everybody. And as I said earlier, that not addressing the predicament of somebody is putting in jeopardy not only the life of that person, but the life of the institution, of the community.
Right.
And we care for all black people. Okay. Just we are there to respond to the needs. Okay. And in fact, I love this wonderful expression which says, I am because you are, since you are, therefore I am. Mm-hmm. The African American Health Program exists to help any black fellow. Okay. Just no matter what is
legal or
just
not?
No matter what is your health problem.
Okay.
Come to see us. We've got an answer. And in fact, I think I should give the address of where we are so that people can just quickly come see us.
Okay. You have a website that you can give us? I know.
Yes, we just our address is 14015 New Hampshire Avenue, the Silver Spring, Maryland. The zip code is 20904, and our phone number is 240-777-1833. And our website is www.onehealthylife.org. Just get in touch with us, and we've got an answer to your health issues.
Clearly, Dr. Nguyen is ready to help people. So, Ms. Myers, you might as well, tell us your website. I know we usually save that to the last segment, but we might as well fit that in now.
It's communitycheer.org,
Okay.
and I just want to second what he said, and also I think your question was, should undocumented people shy away from participating in the options that are available? Absolutely not. This country is a melting pot. The more the merrier, and we want everybody to be healthy and to contribute to the betterment of the country, and you need to be healthy to do that.
Can we touch a little bit more on specific programs that your organization participates in, Ms. Myers?
For as far as health, we have a lot of programs, but I'll just quickly mention a couple. In 2014, we hired community outreach specialists. Their goal is to connect community members with health and wellness resources. We hired several. Some of them are Latino and speak Spanish and English. Some are Ethiopian and speak Amharic and English. One is from the Congo and speaks French and Swahili and English. And they receive specific training in different areas, including preventing cardiovascular disease, diabetes prevention, health insurance literacy, things like that. For the last 3 years, our community outreach specialists have assisted community members during the Affordable Care Act open enrollment periods, and they've helped hundreds of community members by answering questions for them, helping them to fill out applications.
So it's been effective?
Yes, very.
Yes, we have a holistic approach to health issues facing our people. Just not only we do prevention, yes, we do screening, just on and education. We believe that prevention is better than cure. We have program on HIV/AIDS, as I said earlier. We do testing, and we have classes on diabetes. Wonderful programs, and again we have programs on cancer prevention. We have program on oral health. We have programs on infant mortality. Also programs on mental health.
Okay.
We want people to take advantage of these.
And people have been, how's your organization able to bring people in the door?
Yes, people just, we go to communities, and again, people get in touch to us, they call us, and they can walk in, and we are there to serve.
Okay.
Yes.
All right. Well, I actually, benefited from the Affordable Care Act when it first came in. A lot of people can say that they did too, and I had a major surgery, so I can clearly say that I'm one of the beneficiaries of the Affordable Care Act. So thank you both for sharing all the information with us, but we're not done yet. Stay tuned. We'll be right back.
Doesn't see race. Love is love.
Morning, Gary. We are GetSchooled.com. You want a college education, don't you?
You know you do.
Yeah, but I don't know where to start. That's why we're here. We're free, handsome.
Oh, I think we're breathtaking.
And here to guide you through every step of the way, starting with attendance. Gary, financial aid forms. Biology homework, G. I got this. Is that Bran? Colleges love extracurricular activities.
Chess really isn't my thing.
I got this. Doesn't matter. Go ahead. Picking a college, man. You and us. Go together like tacos and Tuesday.
And I love tacos.
Fire and ice.
Those don't really go together. Go to GetSchooled.com for more info.
Hi, my name is Sambal Pujay and I'm a fourth-year doctoral student at Morgan State University. I am currently undertaking research that aims to explore the attitudes around mental health services in the African immigrant population in DC, Maryland, and Virginia. If you're able to participate in this survey, please contact me at the information listed below. Thank you so much.
Welcome back. Here's what County Executive Ike Leggett and County Council member Roger Berlina had to say about the subject of health in Montgomery County.
Well, I think Montgomery County is an exception and model to many other communities because we have a large amount of services, an array of services we provide through the county itself. But as you can see, we also have a large supportive network of nonprofits and others who are working just as hard to provide services as well. The county certainly cannot do it alone. We work in coordination with the state and with many of our local providers in the nonprofit sector in order to bring all of those resources together. And this is what this is about, how we can better coordinate those resources and let people know that those resources are in fact available.
So I'm very proud of the fact that Montgomery County is the healthiest county in the state of Maryland. But that status is not shared by every member of our community, and the African American community has issues. We do indeed have health disparities in our county, and that is what has prompted us for many, many years to focus on the health concerns of various populations. And the African American community, and Pat Grant in particular, has been a very forceful advocate for saying we have particular needs that must be addressed so that our community prospers and lives good, healthy lives. So when you have the second highest percentage of adults with diabetes, as the African American community has, that's a serious issue. When you have cancer rates that are the highest among all our populations, that's a serious issue. And when you have babies that are born with very low birth rates, that's a serious issue. And so our council has heard those concerns and has worked closely with the African American Health Program to create a context in which we could fundamentally address health disparities in a very concentrated, concerted effort and use good outreach to address these sets of issues. So last year, we decided that we would increase funding for these efforts by $250,000 going to the African American Health Program. And again, for things like data. I mean, if you don't have data, how can you go about doing this work? So you need to have better data. You need to integrate diabetes and heart sets of issues so that when you are addressing these health problems, you're doing them in a good, integrated way. And then you have all sorts of behavioral and mental health issues that are not just the problems of the African American community or the problems of all our community, but you need to address these sets of issues. So we have worked on the priorities of the African American community and the African American Health Program to say this is important, and I'm proud to have played a role in making sure that does happen for our community.
So this has been a very informative show that we had today. I almost don't want it to end because I have so many more questions, and I'm sure our viewers can benefit from everything that we shared today. So, Ms. Myers, any final comments that you want to give us about what we discussed today, about your organization, about the programs out there?
Sure. I'll just quickly say a little bit more about CHEER. In addition to health, my organization also focuses on housing, civic engagement, and youth development. In housing, one of the things we do is we work with renters to facilitate the process of starting and sustaining tenant associations. We provide leadership development, peer support, share information and resources with them, help them to find opportunities to get to know each other better and build relationships with each other. As far as civic engagement, one of the things we do is we work with some elementary schools in the Tacoma Park and Long Branch area who have linkages to learning, which is a YMCA program that's based on the farms rate for schools, which is free and reduced meals. And we attend their monthly morning coffees and connect with the community members and give them presentations about topics of interest to them, like health insurance literacy, Affordable Care Act, renters' rights and responsibilities, things like that. For youth development, we worked with local organizations and community members and who are committed to the advancement of youth, and we created something called the Tacoma Park Youth Collaborative. With the support of Making a New United People, Montgomery College, and many others, we offered entrepreneurship training courses, work readiness courses to Tacoma Park youth and other youth within the area.
So give us that website one more time.
communitycheer.org.
Okay. Doctor, tell us about your final comments, you know, what you want people to really go away with after they watch this show.
Yes, this is what I want people to go away with, that the African American Health Program is there to help you to be healthy. And I want people to know that the well-being of their institutions, business, families, churches, depends on the well-being of their individuals. If individuals in the family, churches are not healthy, just they cannot do what they want to do. Okay. And the African American Health Program is there to help them, just to make sure that people are healthy. And we are just inviting them to come to us to use our resources, okay, so that together we can really just engage in such a dynamic way our communities in this culture of well-being. And the African American Health Program is very much aware of the social determinants of health. Our approach to health promotion is holistic. And just our website is there. Just
what's the website again?
That's www.onehealthylife.org. That's our website. And the phone number is 240-777-1833.
Thank you both so much for taking the time out from your busy schedule to be here today. And thank you all for watching. Make sure you tune in next time to one of our awesome, outstanding, and informative shows. Thank you for watching.
It's been a pleasure. Thank you very much.